With the global pandemic on the rise, many US hospitals have pivoted from their conventional clinical rotations to online telerotations. In this video, we'll discuss who should apply to these telerotations, the pros and cons, and how to apply to them. Now, there are a lot of rumors going on about these telerotations, like they aren't valuable or they're just a waste of time. In this video, I'm gonna break down who should be applying for these telerotations, why you should be applying, and how to apply for them. And if you have any questions or you just want to follow my path through residency, please add me on Instagram at Dr. Chala. And if you found this content helpful, please leave a like and subscribe for more future content like this. Now we have to answer the question, what are telerotations? What do you do in a telerotation? Well, telerotation is similar to a normal clinical rotations where you see patients, take their history, and you discuss the case with the team later. But now it's going to be all online. Remember that these rotations and the structure of these rotations vary from one place to another. Now, I tried my best to gather as much information as possible about this topic, but there isn't much information online, so I asked 10 to 15 people about their experience through these telerotations, and I've compiled the information and tried to make it as simple as possible for you. So telerotations are done over these video softwares like Zoom, but these are HIPAA compliant. Now, this just means that you won't be in trouble for having access to patient information. So on these video calls, you talk to patients, take their history with the medical team and the attending on the call, and then you discuss the case later. So they may vary from one rotation to another. Generally, the way they're structured is that the first week is an observatory week, where you observe the attending take these cases and he teaches you slowly what you should be doing, whereas the second week onwards, a different student takes a history and then we all discuss the case afterwards. In some programs, you have an access to the EMR, or the electronic medical records. Now, this is good because it's going to give you exposure to the EMR, so later when you do start your residency, it's going to be easier to adapt to the system. But remember, not all programs offer this. So when you take the history, you're going to enter all the information into the EMR and then present it. Other programs are just observational throughout, where it's sort of like a shadowing where you just observe the attending taking histories. Now that we know what telerotations are, we should know the pros and cons of them. Now let's start with the pros. First, the average time you spend compared to a normal rotation is far less. In a telerotation, you'll be spending anywhere from 15 to 20 hours a week, whereas a normal clinical rotation is a normal 8 to 5, and it can even be longer than that. Normal hands-on rotations can be expensive. You have to pay for travel, food, accommodation, and the rotation. Whereas telerotations are done from the comfort of your own home in your own country. And that brings me to my next point. You can attend these if you're in a different country. So I'm from India, and many of my friends did their telerotations while they were in India. Generally, when you're doing your normal clinical rotations, you won't have time to be studying for step 1 and step 2 after because it's taking so much of your day. But with telerotations only taking 15 to 20 hours of your day, you'll only be spending 4 to 5 hours a day, 3 to 4 times a week. So it's much easier for you to be able to study for your step 1, step 2, or any other exam while you're doing your telerotations. These telerotations provide an easy way for you to get a quick LOR from the comfort of your home with less time. And these LORs will have the hospital's letterhead, so they will be definitely official. These telerotations also provide us a quick way to build our resume. Now, as an IMG, we don't focus on our resume from the start, but with the system changed to a pass-fail system, our resume or our CV will be a lot more important. So these telerotations provide a quick and easy way to get LORs and improve your CV. Now, not all hospitals mention that it's a telerotation on the LOR, but I don't think this is something that you should expect. Some programs mention that it's a tele and some programs don't mention that it's a telerotation. And this is not something you can ask the program. So I would just suggest that you always assume that it's not going to happen, but if it's going to happen, it's going to help you significantly. And lastly, you also may have opportunities to write case reports. You're going to be discussing a lot of cases every single day, and this will give you access to interesting cases. And if the case is interesting to write a paper about, the attending will more than likely be happy to help you write this case report. But with these pros come many cons also. The LORs that you get from telerotations are not as effective as your hands-on USCE like clerkships and electives. These LORs will be as effective as probably an observership, because you won't be spending as much one-on-one time with the attending like you would in a normal rotation. Your LOR may be a little bit more generic than you'd want it to be, and if it's less personalized, it's less effective. Having said this, I still think it's better to have a telerotation LOR than an LOR from your home country, just because it still shows that you've had some exposure to the American healthcare system. Rotations are generally a great place to make contacts and network, but telerotations makes it hard because it's all over a video call. You're not given the opportunity to meet different people, and networking becomes really hard. The exposure to the healthcare system isn't as great as a normal rotation, again, just because it's all over video and you're just going to be talking to patients and taking cases. So if you want to do this solely for exposure, I highly do not recommend it. But if you want to do this to build your resume, then I would definitely say it's a quick and easy way. Lastly, you may not get exposure to the EMR, and not all programs provide you the opportunity to use the EMR. And this really won't affect your rotation that much, but using the EMR just helps you adapt to the residency program a lot easier in the future. So we talked about the good and the bad, but now we have to ask the question, who's the ideal candidate for these telerotations? For the people who are applying this year but didn't have the chance to collect their LORs, this is a quick and easy way to get your LORs required for your residency. For people who are applying next year but they haven't really spent time to focus on their resume, I really think that this is a quick and easy way to take advantage of this whole global pandemic situation. If you're in a different country and just coming to the United States is difficult, it's a really easy way just to do it from the comfort of your own home. And I think a really important factor is that if you're preparing for your steps and you don't have any classes or any other obligations that you have, then you can be doing your telerotations along with your step 1, and I highly recommend this. But I wouldn't recommend this if you're in your last 3 months of preparation, because every second counts in your last 3 months of prep. This is also helpful for graduates who can get clerkships or electives and they need to overcompensate with research and observerships. And lastly, if you're just afraid of this whole post-COVID-19 global pandemic going around, then you can just do this from the safety of your own home. I also quickly want to talk about who don't need to apply for this, and these include the people with 3 to 4 LORs who already have a well-built resume, or they just want exposure from the healthcare system. So now you've decided that you want to do a telerotation. How do you apply? Well, you apply through certain programs or companies, and this is the most common way that it's done. And the companies that I've seen people use are ACE-MD, Ameri Clerkships, AMO Opportunities, Brooklyn USCE, Chicago Clerkships, and USMLE Sarthi. Now, there are many more that are actually offering telehealth, but I personally don't know anybody that have used them. So if you use them, you can use them at your own risk. And there are a lot more companies like these also, and all you do is just Google telerotations and you'll get many. So please do your research before using any other ones. Now you either contact these companies or you call them, and every single one has their own procedure. And the selection criteria is quite lenient in the sense that 95% of the time you apply for it, you will get it. Most of the programs don't require step 1. However, I would suggest you to check and make sure what all the requirements are. So now you call the company, but what do you ask them? So I've compiled a list of questions that you can ask the company to make sure that you get your best telerotation. First and foremost, you want to know what your role will be. Will this just be an observatory telerotation, or will you actually be able to interact with patients? You'd want to ask if you get to use the EMR, or the electronic medical records. You want to make sure that you will get an LOR at the end, and this LOR has the letterhead on top of it. You should ask them if they require step 1 or they have any other requirements for you to start these. Ask about your daily schedule and how many hours you have to spend every week. Remember that the time difference can be a little difficult, so you have to make sure that you can adapt to the timings. Next, you want to ask about the cost. Generally, a telerotation can cost anywhere from $1,500 to $3,000. I know this sounds like a lot of money, but still this is much cheaper compared to a normal rotation, because with that you also have to pay for your travel, food, accommodation. And last, you want to ask if you're going to have any opportunities to write any case reports or do any other research. Now, I do want to say that if you are in the United States, I would definitely suggest for you to do hands-on rotation, because this will have a lot more priority on your resume. Hospitals may not be giving as much clerkships and electives just because PPE or personal protective equipment is limited, but a lot of clinics are still offering externships, and these will still add a lot of value to your resume. Now, if you have any other questions or you just want to see my journey throughout residency, please add me on Instagram at dr.chala. And if you found this video helpful, please do like and subscribe, and comment in the comment section down below for topics that you want me to make a video on. And while you're still here, check out some other videos on my channel. My videos are aimed to help IMGs with the entire USMLE process and help them match into residency. Good luck.